excited that you're here with me. I appreciate what you're doing by watching these videos. They are helping me work through some of the stuff that I have going on in my daily life. So today we're going to be talking about, how do you talk to a healthcare professional? And the thing about it is, and that we need to remember, is that healthcare professionals are just like you and me. They fail regularly. They have the same problems. They have marital problems. They have indigestion. They have eating disorders. They're just like us. So the reason that I'm talking to you about this is that when I go into a healthcare professional, I expect them to give me the answers, and I expect them to communicate effectively with me. I used to work in a hospital for 8 years, so I know that the doctors are just as human as anybody else. They shouldn't be put on a pedestal. And that reminds me of a joke about what is the difference between God and an orthopedic surgeon? Well, God doesn't believe that he or she is an orthopedic surgeon. So where I'm going with this is that we need to create a system where we can go in and get the answers. Now, when we go in, we want to be focused. We want to understand that, why are we there? Do we have a cold and we want some antibiotics? Do we have a broken arm that needs to be mended? Do we have a ulcer? Do we have foot problems, back problems? Do we have psychological problems? Well, why are we there? And the next thing is what kind of action? Are we going to get a prescription? Are we going to have to go to therapy? Are we going to go to surgery? What are the steps that are going to need to take place, and what is that timeline? Is the timeline 14 days like an antibiotic, or is it 6 months for a hand surgery? We need to be aware of what's going to actually happen. And then more importantly, we need to know whether or not the action that we're going to be taking, is it going to cure us? Or is it a Band-Aid? Or do we have to do something else? And what's the prevention? I'm more about prevention. I'm not excited about going and spending my hard-earned dollars on deductibles and insurance co-pays or any of that. I'm more interested in finding out that fasciitis that I have. Well, I haven't had that in years because I'm on a therapy that prevents it. And I don't happen to have a lot of aches and pains because I go to the gym on a regular basis, because that's prevention for me. I'm not interested in Band-Aids. I want cures. But that's a personal point. And when we are going in and talking to the healthcare professionals, it's emotional. Yeah, you're intimidated by them because of their dress, the way they speak. They use those multisyllabic words, and it becomes intimidating. Well, realize that if that healthcare professional has the same problems as you do at home, at work, personal life, then they should be fairly easy to talk to. So one of the things that you've got to remember is that when you walk into a hospital or into a doctor's office, number one, they've got to be able to identify who you are. And they want to make sure that they get the right patient records. This is very important. And we should be forthcoming with all this information. The other part that the doctor really wants to know is, how are they going to get paid? And if you can provide some type of insurance or copay or something like that that ensures that they're going to get paid, they're happy campers and want to give you great service. So one of the things that we need to be pointing out is that when we're talking to the professional, if we are focused and we know what we're there for, then we've got half the battle. And the thing about it is that if they start using those multisyllabic words on you, you need to say, look, I just don't understand. What is going to happen? And then they're going to tell you about all this. And it's kind of like, well, help me out here. Because you should be able to immediately put on to Facebook, immediately call your best friend, call your spouse, your partner, and say to them, this is what I've got. This is what they're going to do. This is what the timeline is. And more important, this is what it's going to cost me. So if we can do that when we go into the healthcare professional and be persistent, that if they give you the multisyllabic and confusion and you don't understand, stop them and say, I don't understand what you're telling me. I don't know how to implement this in my life. Then they start again and you say, this still isn't working. I don't understand what you're telling me. And then they start again. If it takes 15 times before you actually understand it and can tell somebody else, guess what? Your self-confidence and the fact that you are actually going to be treated and that treatment's going to work goes up dramatically. The other part about the healthcare professionals failing is that we as patients do a lousy job of communication. Right now, there's a thing called technical, let's see, what is it called? It's called, healthcare over the internet, where you do a Zoom call or something like that. Well, if we come on and we say, oh, we're feeling great, well, guess what? You're not. Otherwise, you wouldn't be on the phone or on this call. So we need to be able to communicate to them all of the symptoms. We need to be transparent. We need to be on top of the table. We need to talk about all the food that we're doing, the drinking, the smoking, the exercise, the stress level. We need to be talking about new things that we put into our diet. We're talking about new things that are being injected. Where have we been? Have we been out of the country, across country? Have we just got the same routine? It's important for people, the healthcare professionals, to understand what some of our habits are. Like, what do we do for exercise? What do we do for entertainment? Are we couch potatoes? Are we running a marathon? Are we practicing to run marathons? So the more that we tell the healthcare professional about what we think, how we run our lives, what's happening in our lives, the better off they're going to be in communicating. Now, one of the things that's very important is that when we're talking to them about the cure or the Band-Aid or the prevention, we need to understand, is this the typical American Medical Association dogma where they're just going to slide you off with some pills, or are there alternative medicines? Or is there physical therapy? Is there acupuncture? Is there stress reduction? What else can we put in our lives in order to make our lives healthier, happier, better? Because I'm all about wanting to be healthy and happy, and I want to make this thing work because I plan on living a long time and spending all of my children's inheritance. It's going to be fabulous. So I appreciate coming by, stopping by, looking at the video. If you're interested in learning more, I'm going to have in the Mach 1 coach, I'm going to have more information about mindset and also some things that are going to help you understand what are some of the causes of disease. So it's a closed group. I'm only going to let people in a day before the actual video. So I look forward to seeing you. You have a great day. Thank you.